And don't forget.
So Stephanie, if we have fewer than a quorum, which is possible, do we just start talking? Don't call to order, just,
No, you can call to order and everything. You can't approve the agenda. You just move into everything.
okay.
That's good to know that.
So because I have heard from a couple of folks who are not going to be able to, here comes Kyle, so now we have 3 board members.
Okay.
Lynn, I'm going to sign out really quick just because I'm logged in and try to re-log in.
Okay,
I'll be right back.
I'll watch for you. So Joe,
Yes.
I am here in the Shields Carter room for compliance with the Open Meetings Act as revised under the emergency provisions in the extended executive order by the governor of Illinois.
Mhm.
Leon is here too. He's in the hallway in case anyone from the public should come by, because often these doors are not open or people might not realize they can come in. So he's there if someone comes by. So when we get, there's a certain point in the meeting after which, after the public participation, it might be good for us to release Leon.
Yeah.
Because there's better Wi-Fi in the office and he would also have access to all of his files down there.
Sounds good.
So that's pretty early on, but just to let y'all know, in compliance with the revised rules, that's what we're doing. And we don't know what to expect for June, whether a remote or in-person meeting, but Champaign County was the first county in Illinois to be moved from low risk to moderate risk for COVID. And then that was a couple of weeks ago, and things got like pretty wild since then. So there is a pretty high incidence now all over the state.
Seems to not be going away.
Yeah. So now,
Got John. File. And Matt will be back.
he'll be back. And I believe that Elaine Palencia and Alexa McCoy are unavailable, and possibly Jane Sprandel as well. So that leaves, I think you guys are it then, right?
Seems like it. We have someone else who has been added to the board.
Tomorrow. She'll be officially appointed tomorrow. And I haven't seen her come in yet, but she's certainly welcome to attend this meeting or the study session.
Daphne, have you heard from her?
Oh, no, I haven't heard from Daphne. You're right. Thank you.
We have 4 right now.
You could just, if you want to get it started, if somebody else comes, then do we do roll call again, Stephanie? Or
No.
approval of agenda then, or just keep going?
It's a study session, so I just keep going.
Okay.
Let's let's go. So we're not doing a call to order, a roll call or approval of agenda. So we're jumping down to citizen input.
Do you want to do roll call first?
Yeah, we need to do roll call. Matt Hausman,
Here.
Daphne Maurer, Alexa McCoy, Joe Omosagie.
Yeah.
Kyle Patterson,
Here.
Elaine Valencia, Jane Sprandel, John Paul Joachim.
Here.
Okay.
It looks like folks who are not board members or staff are signing into the chat, which is very helpful for us. If you don't mind putting your full name and agency affiliation, that helps a lot with minutes. So,
Thank you for doing that. So let's go ahead and have citizen input right now. Okay. Let's move on. So it's just a few comments. I mean, I think as a nation, we keep having these incidents of racially motivated shootings, killings. Mental health is health. It's not something to be separated. And we've got to find a way to keep having conversations that open us to a better, we're better than this. We're better than this. That's what I have to say. So let's go. Let's just dive in.
all right, so I'm going to share the screen. I put the link to this study session packet into the chat for anybody who might not have it. Continued review. So here are the staff program summaries of the 2 applications from Promise Healthcare. So those appear first, and there are lots of little questions. There's like wherever you see italics, that's a staff comment or question. And then later in the packet, like after the draft of staff recommendations, there are responses. So it's way down here, but it might be more helpful to go there. So there are responses from first followers to the program summaries you saw in April. There's a response from Grow in Illinois. I think I drew squares around their comments. We have had a meeting with them about all of this. They're also present on this study session if there are any follow-up questions. And then Promise provided us with, in the same format, they took the program summaries and then responded to the staff comments and questions. And they reference attachments that are not in this packet. I kept those attachments out of the packet because they had personnel information, but I have them with me. So if anyone has questions about those, hopefully I can answer. And we also have representatives from Promise who are here. So I don't know how you would like to move through this.
We just want to start with Promise.
Okay.
And if you say that.
Do you want to start at the back of the packet where their responses are added to the staff summary?
Sure.
It's a really weird way to organize a board packet, and it really just happened because of the timing. Is when all that stuff came, I just put it at the end. So I'm sorry. Okay.
No, sorry, go ahead.
Right.
Go to the end of it.
Okay. So the first program summary is about the mental health services contract, which is a larger funding request.
Mhm.
It continues a program that's been funded for a while. We were just looking this afternoon at the contract levels. This has been a 2-year contract. It started a little lower and then it went up as they filled vacancies in the program. we don't think there have been any vacancies since December of 2020. Maybe, sort of asked that question, they're looking into it for me. But as you go through this, then the first page, there's no response. On the second page, they have identified corrections to the previous service data that they reported during PY 21 and PY 22. They are working with Leon Bryson. They actually started working on that today to make corrections in, actually not in this program, but in the other one. But my hope is that they'll address these revisions when they get done with the others. They did provide an attachment that shows, it shows where the differences are. So this is one of the things that you, when you're filling out an application, you're asked to report on historical data that we already have. So when there's a mismatch, we usually can see it. So what they're proposing here is to fix the mismatch, which is what we would like to see. And the comment is, I think we all watched this program change during COVID and COVID mitigations, especially when people were afraid to go receive services. So then the next set of comments are on the third page of it, referencing a revised program plan. So this is the kind of thing where, like, we've identified some mistakes in all the, across all the applications. If we have found what we believe to be mistakes, we've identified what we would like to see corrected. So this is their, they've done a draft of that. And here's, the reconciliation of the two different application forms to make sure that they match. So when they're referring to attachment A and B, that's what they're talking about. Attachment C is the same as B, except it's for the counseling part of the program. This one's, the reporting is a little bit extra on this one because we're funding psychiatry and counseling. So they report on those separately, but through one contract. So that's why you see duplications, and also why this chart right here is so different from the others that you've seen. Then in the financial analysis, they reference attachments which correct correct errors in the presentation of revenue and expense forms so that everything is balanced. And it there's a little bit that one program is simplified. I think it's wellness is simplified. This one is a little bit simplified, but they balance now. Then here, attachment E is, this is also not the application, but one of the reports that was submitted. There was a blank space and they've filled that in now. So whenever Chandra Somerville is ready to work with them on revising that report, they can go in and submit what they've showed us they would like to submit. Then the budget narrative that I looked at initially didn't match well with the other financial forms. It was probably hadn't been updated at all. So there is an attachment, which is a draft of what that application form would look like as well. And then here are just responses to the contracting considerations. So if an award is made, then prior to that award, they'll go into the application system and make these changes. We have been talking about this letter of engagement for the audit because they're on a different fiscal year than most other agencies, and their CPA firm is not, won't be able to give them a letter of engagement for 2022 until the 2021 audit is submitted. So that was an issue that I raised here and that we've actually been talking about for the last couple of days. And then the final issue, okay, for the special provisions, this was simply special provisions that already exist in the contract are related to how they show the financials at the end of the year, since they have this other, they have a different fiscal year. than we do. So that's one that's just standard. And then if there's a note here about if a 2-year contract, but that's separate issue. And then asking that they collaborate with the Champaign County Christian Health Center because they are serving very similar populations and there could be some efficiencies and even some mutual support there. So they actually added that in one of the revised application forms, but it would still be a special provision. So we'd still like to see that. Anyway, and that's it for the first program.
There is a mistake in the evidence of collaboration. It's very minor, not a big deal, but there is no Carl pediatric residency. There's only a family medicine residency and psychiatry residency. So I would just delete that part.
So that should be changed as well.
I mean, they should just, yeah, there is no pediatric residency program. There's pediatricians that family medicine residents may go under, but at Promise, there's no pediatricians there. It's family medicine attendings with family medicine residents underneath them that do like family medicine care, OB-GYN stuff, all that kind of stuff.
Okay.
So,
Okay. Thank you. I'm sorry, I'm getting really sweaty in here. I don't know if it's the stress, but anyway, okay. Are there any other comments or questions on this one? Okay, then the second one is the wellness program. That is the smaller of the two programs. This is one where there appears to have been a vacancy, at least one vacancy, and maybe 3, and we're trying to figure that out right now. It's difficult because the term of this contract started before Jennifer Henry was with Promise and also before Leon Bryson was with Promise. So it's kind of on me, you know, to like, there's a lot of details that I don't normally tune into that I have been sort of striving to catch up with in order to fully understand what's going on with this contract. So the adjustments that they have proposed to make here in response to our contracts are, there are quite a few in terms of the service reporting for all of program year 21 and so far in program year 22. These have to do with mismatches that might have started with very simple mistakes. And then underneath that, there's the fact that the program has been somewhat underutilized because of vacancies. So we're trying to get our arms around that. As far as moving forward, I didn't have any problem with the way this was presented, but they're saying here in the red type that they can explain what happened, and they did provide an explanation. And this is the set of previous reports that they're working on with Leon Bryson to correct now. So some of the data here don't match, but they've been able to explain that. So if we were to run this analysis again, it would match. So anyway, that's helpful when it comes to the annual report that we put together for the board, because we do want a truer number of how many people were served. And so they're in progress working on that. It does not have implications for the application though. Then here, this is about the application. Again, the first 2 forms in the application didn't quite match. So they have created drafts of those revisions that make everything match. And the utilization targets make sense given previous. It is possible that if they've been underutilized and understaffed, that maybe the program could continue in a streamlined way, but that is not what the proposal is for. It's, you know, to continue what they were able to do pre-pandemic. And then here in the financial analysis, it's the same critique as in the other program where the financial forms didn't balance. And so they have sent us the attachments are drafts of balanced revenue and expense forms. And also update, like the piece that I didn't want to share publicly was all the personnel stuff behind it. That's just, I mean, you can look at it, but it's not really appropriate for us to share publicly. So those are, let's see, so the surplus that we were looking at and asking about is not there now. There's still, these funny issues with the audit because they have a calendar year. It's a little harder to analyze. We need to get the next year audit before we can fully understand, because we're funding for half of their fiscal year each time. So it doesn't line up quite right. But looks like the next audit will be at least we should have it before September. That's the hope. So then this is exactly the same as the issue in the other one where the CLC report is for the whole agency. There was just one block was missing and they have filled it in. And they'll just work with Chandra Somerville to resubmit that one. It's the same report. Then here, the reference is to attachment J. That is, again, that's the budget narrative. That's the final of the financial forms. It's the one that describes what each expenditure and revenue is for. It attests to not supplementing Medicaid. So the initial budget narrative did not match up, but the one that they've shared with us as a proposed revision matches everything up. Then do we have that pediatric residency is mentioned here too? So that would be another that needs to be changed. Then again, here in the list, these are just comments about things that would need to be revised prior to contracting, and there's, they're agreeing to that. And then again, the collaboration with the Christian Health Center. Okay. Did I get it all?
So, is there anything that you'd like more information about? Because I think Provis is here to talk about this.
Would it be helpful for me to stop sharing the screen for discussion or leave it up?
Stop for discussion.
Okay, here you go.
So, I mean, I think I can start. For, Promise, it's, these requests for funding are pretty large requests. And, with the history being as it has been, I want to make sure that we have all the, T's crossed and I's dotted, because I don't want to keep ending up with having to push things out to make sure that, all the money is going where it's supposed to go. So I know that the audit is something that is going to take some time. And I think I know it's supposed to be done June 30th. And I think I know you said the firm was not going to have it done until hopefully before September, but that's supposed to be the deadline. And after that point, normally we would terminate the contract for agencies. So, I would want to know what the group's thoughts are on what would happen in an eventuality if the agency was not able to comply with providing the audit for for getting the access to the funding. If we want to just kind of see and wait, or if there's other things that we want to put in the process. But I mean, I do worry about making any 2-year contracts for Promise anywhere in the near future. I think because of the change in leadership, I would only approve 1-year contracts. And I think I would want to make sure we have good oversight to make sure that there's a consistent accountability over the next few years at least.
I'll echo that. I agree wholeheartedly with that. that with what we've been dealing with and making sure with the change in leadership and everything, we want to make sure they've got their house in order if we're giving these larger grants. One thing I mentioned to Lynn was we've talked about trying to get to more board meetings for some of these agencies. And I think this would be one that should be a high priority for a board member to maybe go to some of the Promise board meetings, just to kind of, as John said, have a little bit of oversight as we're doing this.
Thanks, Matt.
So when, at your meeting next week, we'll have that as that chart of all the liaison possibilities at the very end of the board packet. I don't know right off the bat what time or date their board meetings are, but there are folks here from Promise. Does this sound all right? Like, the mental health board used to have official liaison assignments, and they've sort of loosened it up so they can just go at their convenience to any agency board meeting. And this is why we have that chart of the times, which make Stephanie.
It looks like it's the fourth Tuesday of the month at 6 p.m.
5:15.
What was that?
5:15. 5:15.
5:15. Okay, thank you. We'll change that.
And we are still meeting virtually, so you just have to let me know so that I can make sure you get the link for that.
So that would be this coming Tuesday, right?
I think it would be May 31st, so in 2 weeks. No, wait, you're right. It's the 23rd. 24th, I mean.
Okay. Is there anything else that you want to talk about with regard to these two applications and to the subsequent revisions?
And John John and Matt have said it all. And we just have to keep an eye on what's going on. You know, the last couple of years, lots of changes have occurred with leadership, but it's something we have to keep an eye on.
Okay, so if you want to go backwards through the board packet,
Yeah.
the other feedback came from First Followers and Grow in Illinois, and they were responding to comments also. They didn't point out, factual errors in our work. But they responded to some of the concerns, and we have actually, a couple of great conversations with folks that Grow in Illinois to work through some of these issues prior to anything else. And they're here. So anyway, I just wanted to point out that those documents are here and that there might not be anything to follow up on, but they're in the packet. I appreciate them responding. They both got those responses to us really quick. It was great. So if you want to talk about any of that, I don't know.
So for Grow, the one question I had was, I think in the past meeting, we talked about how they were servicing other clients outside of the county, but I was wondering, one, if they're still going to do that, and two, if they have funding from elsewhere, because the funding is supposed to only be for servicing Champaign County members.
We did talk, there's two of the folks involved in that conversation are right here, probably ready to address that. We did talk about it quite a bit. We actually also reached out to the Vermilion County Mental Health Board and said, this is a great program. If you want people from Vermilion County to be included, how about some money? So anyway, but you all can summarize the rest of that conversation if you, and Leon Bryson was also involved in that conversation. So I'm going to take a little break.
Well, and I think this is Carrie, and I'm with Grow. I know on one of our groups, one of the members that attends from outside of the area is also part of our leadership and is a volunteer helping facilitate one of the groups that we're having until someone can come through the group to take on that volunteer position. And so since we're just now starting to get back in person and, you know, keeping a pretty good finger on the pulse of the leadership that's attending and starting to come back into the groups. I think us being able to fill those positions will come sooner rather than later. And so I think in that respect or that regard, that was one of the explanations that we offered to, you know, during that meeting. And then the other ones, we've actually been working on an idea of starting another strictly virtual group for all those outside of the county that would not be included in anything that the mental health board would be funding. And, you know, so I don't know, I wanted to get some feedback from you guys about that.
So are you meaning that these Vermilion County folks or whatever county outside of Champaign County will attend, but you will not record them as, you just record the numbers, but that's okay.
Well, here's what happened, Leon. When we put things out virtually and it ended up on our web, or Joseph, I'm sorry, it ended up on our website. Then we had people from everywhere. I mean, it's something we've never really dealt with before. And me coming in really cold, I hadn't been involved in Grow for a number of years. And I had no idea that was a part of it. And that's why I wanted to work on the reporting. So we have discussed this, and we definitely can use the Grow in America umbrella, okay, for the people who are outside and not have to, you know, still they can have their Grow community, but I think the problem will solve itself when we go back in person. Does that make sense? Yeah.
Thank you. Any other
You're welcome.
questions or comments?
And I know a question I did not address, and I can't remember the person on the board that asked me about it, but I spoke with Chris about, he wanted to know about our benchmarks. And Chris said that our 12 steps is what he uses for our benchmarks. So I want to make sure that question got answered. We also do a survey. We're really wanting to get that perfected, make sure we really get people surveyed this year and see where they're at and see their progress by next year. And we're already started on that. We have a few of them done already. And I'm really hoping that we'll have better benchmarks next year for, you know, our recovery process.
That was Mr. Hausman's question.
Okay.
Yeah, I just want, we need to look at the old, what I was at the proposal first before I remember what exactly the question was. But yeah, I know I asked about those benchmarks and where they were starting from to see what kind of improvement was seen.
Yeah. And definitely our survey does show improvement. I think that we have another survey that we've used in the past that I would like to use the one we got and then kind of combine it for people who've been in Grow for a while and have gone through the recovery process. So I really want to look at that. And then the other part of our deal is that we counted hours of service for years. And then I got into that report and I'm like, oh, we don't do hours here. So that really kind of confused me. And so somewhere along the line, I'd like to, and Lynn and I discussed this, get that to where, because we provide a lot of things for a lot of people, and it does require a lot of hours. So somewhere along the line, being able to report that.
Thanks.
And the other thing that kind of goes back to the hours as well, like our program not only serves the individuals, but it also serves their families. I mean, we have events where every month their children, their spouses, I mean, we really service the entire family. And there's no way to kind of incorporate those hours. And it's, I don't know, it's an amazing process to watch from when someone very first enters the GROW program through maybe even 12 months later where they're at in their recovery. It's an amazing process to be able to watch throughout the time. And, you know, I mean, I've had conversations with Lynn and Leon, like I've been involved with this program off and on for over 20 years because of what I've seen happen as a result of people coming in and through our program. These are people that become the leadership of our program. And then they go out into the community, and just the way that they're, you know, it impacts every aspect of their lives, you know, not only their family, but being able to, you know, have that self-confidence again, to be able to go into the community, get their jobs, get their housing, get their things in order. And to watch that process is just amazing. And Brenda, I mean, she's been involved in GROW off and on probably for 30 years and was our state coordinator when we had full funding through the state. I mean, we used to have $1 million budget. So I don't know, when I was very active in GROW, we had over probably 150 GROW groups throughout the entire state from stem to stern. And then when we lost funding and we had a residential center, I mean, GROW's been around for a while, and next year we will be celebrating our 45th year in Champaign County. So to watch this and see the people come through this program is just an amazing thing to watch. And, you know, I work a full-time job during the day, but I guarantee you I volunteer at least another 20, 25 hours a week, because that's how much I believe in this program. So that's all I'm gonna say.
Thanks, Karen. Any other questions or comments about GROW? Okay, let's move on to first followers.
So those remarks are pretty straightforward. They also submitted a full revision of the financial stuff to resolve the inconsistencies that we pointed out in the financials. So like similar to the attachments that Promise sent, they did that, it's ready to go, but I wasn't totally comfortable with sharing that information in a board packet. Didn't know if they meant for me to, but in my opinion, it's balanced and it reconciles the issues we brought up.
Okay, sounds good. Cool.
Okay, so are you guys ready for the main event?
Yes.
Okay, like this is, you know, I'm after this meeting, I'm going to go back to the office and make revisions to this briefing memorandum with staff recommendations. I already have made several revisions to what you have here based on information that agencies have shared with us. Several of them have given us that letter of engagement with the auditor, so I'm taking that out. But the broad strokes, essentially the recommendations themselves are the, kind of, if you're open to discussing those tonight, and if you want me to change recommendations to be closer to what you would like to support, we can do that, or you can just, do it all next week. Do you want to see the main decision sections of that memo?
Yeah, let's look at it. And because we're not making any decisions today.
No, you can't make decisions today, but you can see what I've got in store for you. And I realized too that without, more board members here, and many folks are kind of tired tonight, so that, this is just, in the past, it has been helpful to the board to have a look at the staff recommendations before any action is taken, because they get really complicated. So anyway, the first actions that we will request from you are about special language in the contracts. And these are things that we do every year, but well, the first couple are, but it's important that, to have your approval before we do them. So the first one is contract negotiations. Don't know that we're going to have a whole bunch of contract meetings this year. That would be really especially important if we have suggested a lot of revisions and special provisions and the agency disagrees. That would be, or if it's really complicated and we need to sit down and just explain it. So that's what happens at contract negotiation meetings. It has happened that we have had a failed negotiation before. And sometimes that means no contract is issued. Sometimes it means we come back to you for additional advice. Then the next action is, this is the bad news contingency here. If the revenue collected is less than we're expecting and less than you're budgeting for, we could do for across the board reductions or strategic reductions to contracts that you are about to consider now. We actually did have to do that once. It was in 2009. It was very difficult. So I would hate to see us back in that position. We have budgeted much more conservatively since then, but we also have not had a financial crisis like the one in 2008, which precipitated the lower amount of property tax revenue collected. So then here is a continuation of the COVID language. This is not that revolutionary. It's just essentially if an agency needs to make a shift in the middle of the contract term in either the scope of services or the budget plan, or both, and it's related to COVID indirectly or directly, that's something the board would want to be involved with, like that you'd want to know about it, not that you would deny it or make it, very difficult to make a shift like that, but just so that everyone's informed. And this is because when we started this contract provision back in May of 2020, it was really like everything was so different and new, and crisis mode, was generating a lot of very new information. So we continued it last year and it was used a couple times. I think things are stable, more stable this year, but we can leave it in since the pandemic is not over. And the effects on mental health could be long-term and we just don't know. So we left it there. If you are inclined to approve including that in the contracts, we're ready to roll. The next one is related to those funding guidelines that you revised at least 3 times last year, as we are trying to keep pace with the changing conditions related to financial accountability, the cost of CPA firms, the need to have some kind of financial accountability, even with very small programs, but that isn't manageable for some of the small programs. So the last time we went through those funding guidelines, we had advice from the attorney to add language to the contracts so that you could waive something from the funding requirements, or you could allow an agency to spend more money on the audit than the funding requirements allow. So basically this just says if there's a difference between the contract and the funding guidelines, the contract can prevail. And that gives you an opportunity to make adjustments as appropriate without having to bust open the funding guidelines again for a while. We'll have to do that periodically. It's just good policy to revise your policy. But this is we want to put this in here because the lawyer advised us to, this is his language. And then lo and behold, right after you finalized this, we learned that CPA firms were starting to raise their prices. So it becomes relevant immediately. I would like to put this in all the contracts just in case something happens. So that's the easy stuff. And here are the staff recommendations for funding all of that related to all of the agency requests. Do you guys, do you have a preference of how to proceed through these?
Any board member have a preference? Or we just roll through
I don't know, the easier ones first.
it? Easy is a matter of opinion, no?
Well, each one is structured the same way. It's first, the title, we tried to be very careful to double, triple check with the applications so that when we issue contracts, they match what the application said. This intermediate step where the board approves something, this is the rule. So if you approve something where we've made a mistake, that's what has to happen. So we tried to eliminate mistakes. We've got the name of the agency, the official name of the application, the amount of the request, and then this little detail that I think is interesting, how much of the total program revenue does it constitute? You might not care about that. It's not really that important to this stage, but I like it. The priority area, I also like that. I'm not sure it's really that important to you. Required prior to the contract is important to everyone. This is stuff that will have to be done between your approval and the issuing of contracts. This one just has a very small revision within the budget narrative. We want them to explain what the professional services expenditure is for. That's it. We just didn't know. Then there are special provisions. Every contract has special provisions that relate to the type of service it is, and sometimes it might relate to additional reporting because of previous compliance problems. But for this one, it is because the RPC is a county department, every expenditure is audited by the auditor's office, and their full year is audited as part of the combined county audit. So we have access to all that information. We don't need to wait for an independent CPA audit in order to determine excess revenue owed back to the board. That is straightforwardly available in that fourth quarter report. Then the other special provision is if it's a 2-year term, they can't take excess revenue from 1 year and spend it in the other. And then the final special provision here is just this program was going to be like the leader of a strategic plan related to homelessness in Champaign County. And I thought when they get done, it might be nice for us to have a copy of it and maybe even a study session on it. But I just to start with just a copy of it. So,
Right now.
like whenever they get it done. So anyway, the recommendation is from staff is to fund this at the requested level and offer a 2-year contract. We don't know if they would accept a 2-year term, but so just.
Okay. Go ahead, Mike.
I was just say, if I could jump in just as a structural thing for the rest of this. Is there going to be, basically I want to avoid us going through these all if we're going to do the same thing next week. And so what I was thinking is maybe if there's anything that either one of us any of us as board members have questions on, or Lynn, if there's anything you think we should look at that's kind of out of the ordinary, instead of going through each one, if we're going to do it next week again.
Well, so now you know the format of each.
Yeah, I appreciate that. That's why I wanted to wait for that, that you've at least gone through that.
There's also like a lot of the special provisions are the same.
Yeah.
So they're just, every contract has a different mix of those.
Thanks for that.
So that's
So,
okay.
yeah. So if we just open it up this way, is there anything that anyone has seen in this.
So I did have one question. I kind of mentioned, so the defer recommendation on the promise, how would that, what's kind of the process? What are we looking at?
So this was, this recommendation was developed before I received all that input. And I've, tried to share as much of the specifics of that input as possible, because if you're comfortable with what they've shared, if they make all those revisions, we could change this. I mean, you can make any decision you want to, but what I had in mind was not to ask you to make a decision until more information was made available. Quite a bit of information has been made available since I wrote that. Is it enough for you? I don't even know, if I'm comfortable taking defer off of there, because there's still a few issues outstanding, but I do see them working with us, every day to resolve things as they come up. So I would be comfortable to change this motion if you don't think it's relevant anymore. It really was just, I did not feel that you had enough information to make a good decision, or that I had enough information to even make a recommendation.
Okay, because the recommendation was deferring until the audit is available, which we're not going to have anyway. So until September, like somewhere in there. So I don't know if that would change your recommendation, you think, or?
Well, what we can do, like the audit will be, the audit is due June 30th. The contracts would start July 1st. So per the rules, if we stick with the rules as they are, there would be no payments until the audit comes. Or at September 30th, if there's still no audit, we would cancel the contracts. So that's just built into the rules. We don't have to do any kind of special rule for that.
Okay.
But it's holding payments. So in other words, when the audit comes, that if they have been providing the services, then they get paid for the service. This was just so tricky. For a long time, payments were suspended and services were being delivered. And I got nervous about how long can you do that without payments? It's just, and then what if there's a reason not to issue the payments in the end? It's a great deal of risk for the agency to take on. But if they agree, so anyway.
I mean, from my perspective, I would keep the deferment in there and not just give them payments until we get the audit from 2021. If other people have any other ideas, I'm open to hearing about it, but that would be my stance. I think you're probably on the same stance that I am, Matt, from previous conversations, but I'm not sure.
Yeah, I'm leaning that way too.
Yeah, I think at least I know, John and I have talked about it, deferment is still in what we're thinking about here. And wait and see.
So potentially a deferral could mean that no contract is developed until the audit comes. Like it wouldn't start until the audit comes. Are you comfortable with that? Because I can then if so, I will leave this, but I might make some adjustments up here to account for the revisions that have already been offered.
Would that be a situation where we would, assuming everything goes well, then we would include the 3 months or whatever the payments?
If you develop a contract that starts July 1st, no payments will go out until the audit comes.
Mm-hmm.
If you defer and don't develop a contract until the audit comes, it means no back payment would be appropriate because there's not an audit or there's not a contract starting July 1st.
Okay.
So it'd be a pause of services as well as payments.
Okay.
And that would be difficult since they hired the counselors already and the psychiatrists already. And so I would prefer to just keep the wording as it is so that this way they get the payments so that they can keep the employees no break-in, there's no break-in services.
Well, the way to do that would be to fund, I would change the recommendation to fund it. And then automatically per the rules, they wouldn't have payments until the audit came.
Okay.
Are you, is that what you were thinking?
Well, I thought if you keep it the way it is now, it defers it, right? So then the money is deferred, and then when the audit comes in, then they get the back payments. Is that correct or is that incorrect?
It's
No,
us deferring the decision.
right.
Oh, not the payments. Okay, okay.
The payments would be automatically suspended, but there wouldn't be services if there's not a contract that starts July 1st.
So how would we change the wording so that the payments are suspended and that, like, so if I would make the decision to approve the funding in once or the funding will be approved, but then the money will be held until the audit comes in. How would you change the wording on the application or on this motion?
You don't have to do anything because the audit being late prevents payments from going out. So you would simply say motion to fund or to whatever the, let's see, motion to approve CCMHB funding as recommended for Promise Healthcare Mental Health Services at Promise. And
So instead of saying motion to defer, you say motion to fund.
because
But
the payments would be held because of the audit not being available.
wouldn't that be with a new contract? Would that be different though? Okay.
It's because they're like, why this is a little bit odd is that they're using a calendar fiscal year. So it's always been that way. Like it's
All right.
start the contract year out of compliance because the audit is delayed. And this time it looks like that, she's working really hard with that CPA firm, but they're not able to commit to
Yeah, I just would want to make sure we're not getting into a situation where if we don't have some kind of special language like John's pointing out, that if we approve it and we're thinking, yes, okay, we can hold payments until the audit, but they could say, no, wait, that was a different contract. With this new contract, you don't mention anything like that. That I would want to avoid that situation.
well, it's okay to be redundant. So what if I just mention that rule in this recommendation so that it's very clear? Would that be helpful?
I mean, I think it says it though, required prior to contract, or or should it say required prior to funding? Or
Well,
Is
I would have to adjust that. So that, like, to adjust that language, and they have tried to get, the letter of engagement for 2022 and can't. So I would have to change that requirement. And that's where I could mention that payments can be released once the audit is submitted and acceptable.
Yeah.
Does that work? Or I could put it in the special provisions maybe,
that's fine to put in the special provisions.
it's in the contract already. It's in the contract boilerplate already. So it doesn't really need to be brought forward, but if I put it in the requirements, that's one of the first things we will all see and maybe help to clarify. Is that?
I think so. I think that would just make it clear for everyone.
Okay. Okay, thank you. Okay. Are you satisfied with that conversation? Because when Matt said, can we go through this a different way? He did ask for if there's anything special, there is one special thing.
Go for it.
Okay, it's you need to know this, and the mental health board still has the final word on all decisions about its funding. So you don't have to do it just because the DD board wants you to. But this morning, the DD board approved our recommendation that they advise you that they would like to see this program funded for this 149,666 of it being developmental services. So, they are silent on what you might do with the other part of the contract, but they've recommended this piece. And that's related to the intergovernmental agreement between the boards, which holds a certain percentage, it's a certain percentage of the levy amount each year to go to DD services. So this is what they'd like you to do. And I just thought I should tell you. If you don't, we'll go back to them, you know, but you will make a decision May 25th. So then I would probably bring them that information in June and come up with a different strategy. Okay.
And then page 42 with Rosecrans Prevention Services. Obviously, I think a lot of us did, or I'll speak for myself. I don't want to approve the funding for the prevention services. I want to defer it. So that money would be deferred until they come up with some other use for the money, correct?
So we could say like, you want to preserve the focus on the target population. And with, like, y'all had some creative suggestions at the last meeting, and then some of us have individually spoken since then. The focus should be youth and maybe substance use disorder treatment.
Mhm.
So you had talked about Snowball during the meeting, and then Dr. Joachim mentioned maybe using this money to support an addiction counselor for youth. So we were just really sort of sending Rosecrans back to the drawing board saying we do have the 60,000 for something. It might not need to start July 1st, but to come up with a different proposal for you to consider at some point.
Because I mean, from what we know about recovery or prevention happens within the community, and it's not a pull-out, one-shot deal each time. It's a consistent, something consistent that helps move people, propel people along to recovery or to prevention.
I mean, it would be great if they had a counselor that went to JDC and did counseling for those kids that did that were substance abuse, had substance abuse involvement, because those are high-risk kids that probably really need it.
Yeah, back in the day, I did that. That was 1997 or whatever. It's been a while. So yeah, I think prevention is being there, and let's hold it on to it. The money is there, but let's rethink it, because I think we can do better as a community.
It looks like Gail from Rosecrans says they do actually have a counselor that goes to JDC and provides services for that. That's excellent. Do we fund that? And if so, why aren't we contributing to that?
Did I stop sharing to facilitate the conversation? Okay.
Go ahead,
All right, there you go.
Bill, where are you?
We did at one time, many years ago, have a fee-for-service contract for youth services with the mental health board. And because there are so many non-billable types of things that the counselor has to do, the youth counselor especially, because they're in the schools tracking down students, a good chunk of their time is spent also coordinating with staff. Same thing at JDC. So we ended up not being able to actually bill it out because the activities don't fit a billing type of setup. And so because of that, we haven't reapplied. We've been able to make it work based on some of our state funding. So we do currently have a youth counselor who goes out to the schools and also to JDC, and also if asked by other to meet youth in other locations throughout the county, we do that as well for substance use disorders.
And prevention isn't just only about substance use. I think sometimes we've got to broaden that perspective of substance use is sometimes a symptom that we see, but prevention is a lot of other things. Hopefully the counselor or the folks are doing more than just talking about substance use.
Yeah, so our current prevention program does focus on not just substance use, but it also focuses on decision-making skills and teaching some of those things. There are sessions on bullying as well. So some of the behaviors that come prior to substance use and or could put a youth at risk for substance use are discussed and addressed during our prevention services. And it's age appropriate depending on which grade level or age level they're focusing on in that session.
Thanks. Any other questions or comments?
I think I had a question for Lynn. Say we just gave a blanket approval for everything. Would we have enough money to approve everything? I think in the past you said we did. I just want to make sure if that's still
Well,
correct.
It's like that budget process is like a magic show or an art project. It's really, we're very early in the projections for revenue for next year. And based on that, I tried, I've been budgeting really conservatively. So I tried to be a little bit more flexible this year. I think that the shortfall is only about $38,000. And that's survivable because usually we have increases as as the projections develop. By the time we get to November, that it could be affordable. It's just that it's not responsible for me to tell you what we're going to have in November. It's just not, and I tried to contact the county deputy director of finance today, but she had left already by the time I reached out to her. It's probably still too early for her to increase any or to give me any adjusted projections, but I don't worry too much about $38,000. Maybe I should, but that's the shortfall. I think, let's see. I wrote the exact amount at the end of this. Oh, this is 34,845. Now that doesn't count, like there are those beautiful tiny little requests for thriving families. That doesn't count that amount. That would be another 23,491. So, still it's not a huge amount of shortfall compared to the kind of adjustments we've seen in previous years. But I think for me, those were such wonderful applications. I don't know if anybody is here from Thriving Families, but I did talk with Ms. Brandel earlier today about them since she was the primary reviewer on all and really felt they were great ideas. One of my concerns about that is to get an agency started can take a lot of staff time. And we're really kind of, I think we're sort of underwater right now. And we're going to lose the U of I outcomes evaluation project at July 1st. The two professors who've run it for all these years are leaving the university. So I will need to develop some kind of alternative for that. I haven't gotten very far. So just like not feeling very confident about taking on another new small agency at this point, even though the ideas were so lovely and you probably could afford it. So just to be really honest, it's like, it just takes a lot to get a new organization going. So. Was that an answer to the question or just like a?
It was. Thank you.
rambling?
I mean, it seems like we'll have enough, and I'm thinking of it in multiple ways. One is like, we end up proving everything and everything works great. And, I know there was some questions about Dream House or Dream. So hopefully like everything falls in line with them, and they'll hopefully promise everything, like they get their audit done and everything goes well and we approve everything. You know, and if we end up being like 30,000 or so down, that's okay with me. I know we have some room there, some wiggle room always. The other side of me is, well, what if things don't go well and say Promise ends up getting their contract terminated? That's several hundreds of thousands of dollars then we'll have,
Of money.
which is going to be needed for servicing the mental health population. That then, if Promise doesn't have other funding to fund those services, then we're gonna have to find other ways to fund that in other parts of the community. And so I guess we'll be looking at other things in the future. Hopefully we don't go down that road, because I really do not want to go down that road.
Right.
I want everything to work out. I want everything to go well, and I want to be able to prove everything for all these great organizations that are, a lot of people are trying their hardest, but it's just, I know it, sometimes things happen that we don't want to happen. So, you know, so I'm just trying to think about all the possibilities in the future, but yeah.
I think that's the worst case scenario for the community.
Yeah.
There are some worst case scenarios for your fund that go like this, something like what happened in 2020, where people decide not to pay their property taxes and we have a really low collection rate and get far less than was projected. That could happen. Another bad scenario is you fund everything, everybody's, you know, eligible for every single payment that goes out, no excess revenue is owed back to you, and the funding projections don't go up enough to meet the shortfall. So next year, you don't have as much money to allocate. And that's the good thing about your contract year being different from your fiscal year, is that you gain some flexibility. It's just always that threat of having to make tougher decisions next year. That almost feels like, you know, how some states handle their budgets. So, you know, I hate to put you in that position. That's a worst case scenario though. And then the other one, which we talked about earlier, is for some other reason, there's not enough revenue right away, and we have to make reductions right away. Those are really tough, but they're not the worst thing that could happen to the community. Whereas what you're talking about is the loss of large provider capacity, especially for individuals who may not be experiencing the great health outcomes that, I bet you guys don't know this, but the US county health rankings just came out, and Champaign County looks really good in its aggregate health rankings. We're ranked really high. But when you subdivide into that information, the beauty of the aggregate data disappears. And you can see huge disparities in health outcomes. And, you know, unfortunately, a lot of what you are funding is to right size that. So.
And unfortunately, that's the question of health in not just Champaign County, but nationally, and how we fund it. And one thing that COVID has done is shown us inequities that abound within the system.
Yeah, it's true. And I mean, really, it's still to just to make it more depressing. We're still facing a shortage of providers, and it's starting to affect, there's a shortage of accountants to work at CPA firms. There's a shortage of healthcare workers. Like, I wasn't expecting that to happen. So the behavioral healthcare shortage that we've seen for a few years is getting worse in this larger context. So, it's hard to mobilize new innovative services to address those health inequities without staff to do it.
I mean, healthcare always had shortages for a long time. That's why we have a large amount of physician assistants and nurse practitioners trying to step in for doctors and psychiatrists and stuff like that. And then I think with the pandemic, everyone over 65 just retired early. A lot of healthcare providers were in their 60s, 70s. Heck, I had a colleague in her 90s working with us. And so, the pandemic put a lot of people just to stop and just retire. And A lot of them did not come back. They just stayed retired. And then a lot of other people just, started, either quit their job and decided they want to take care of their kids and enjoy their time with their kids more, and, have one parent working instead of two, and they figured out some way to do it, which is great for them. But the problem is that there's a huge shortage now in the field. And it's going to be there. And it's not going to get better, unfortunately. So I think that's going to be here to stay. It's going to be hard filling that gap.
And I think the way it's sort of coming home to us is that as there are efforts made to do workforce development, that's where the focus is starting to be in the healthcare fields. And so it could stall progress in behavioral health. Anyway, cheery. But this is all just to say that, like, it's probably good to spend these funds when you've got them, when there's capacity to invest in.
Cool. So, any questions or comments? Agency input.
I'm gonna go back to the office and create the board packet for next week. And then we've got a couple staff in the office or at least Kim Bowdry is coming in tomorrow morning to put the physical packets together. So teamwork. We're gonna get those to you as soon as possible.
Okay. So, yeah, well, agency input, anybody, anything? Board announcements. Since we have nothing, we'll just adjourn and see you guys in about 166 hours.
Sounds good.
Have a wonderful rest of the evening. Take care.
Have a good one.
Thank you all for your time.
Okay.